Have you ever stood up, heard a sharp pop from your knee, and wondered if you're on a fast track to arthritis?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're looking at what knee popping, or crepitus, really means, what a new 5-year study found about it, and how you can protect your joints without rushing toward procedures you may not need. I guide the discussion and keep us focused on the practical takeaways you can use right away.
I'm Alara Sky, and I'll help break down the data so you understand what those sounds are telling you and what they're not. You'll hear what researchers saw in young adults after ACL surgery, why activity remains central to recovery, and which simple training tweaks make noisy knees feel and function better over time.
Let's start with reassurance. Knee sounds are common. Roughly 4 in 10 people notice them at some point. Hearing a pop or crack by itself doesn't mean your joint is deteriorating. The study we're discussing followed 112 adults, median age 28, all recovering from ACL reconstruction, a group at higher risk for future osteoarthritis. Early on, those with crepitus showed more pain and slightly worse function, and MRI scans often found full-thickness cartilage defects near the kneecap.
Here's the important part. Over the next 4 years, that gap closed. By year 5, pain and function for the noisy knee group looked similar to those with quiet knees. In other words, crepitus after injury flagged early recovery stress, but did not predict continued decline. The sound alone wasn't a long-term red flag when people stayed with rehabilitation.
You're probably asking why the noise happens at all. Several benign mechanisms can explain it. Gas bubbles in the synovial fluid can form and collapse, creating a painless pop, much like knuckle cracking. Tendons and ligaments can briefly shift over bony contours during squats or when you stand, producing a click or snap that resolves as your movement pattern smooths out.
There are moments when popping deserves attention. If the sound arrives with pain, swelling, stiffness, locking, or a sense of instability, you may be dealing with cartilage wear, a meniscus tear, or loose fragments inside the joint. A sudden loud pop during sports with immediate swelling suggests a ligament or tendon injury. Those situations call for medical evaluation rather than watchful waiting.
Other conditions can mimic simple crepitus and tend to bring signature symptoms. Meniscus tears may cause catching or buckling when you rise from a chair. Iliotibial band irritation creates snapping on the outside of the knee, often worse with repetitive bending. Less common problems include plica syndrome, or loose bodies that feel like something is blocking motion. And if you ever hear a crack with trauma, followed by visible deformity and bruising, that points to a fracture and needs urgent care.
Let's shift to what helps. The most effective protector of a noisy knee is exercise. Well-structured strength work reduces the load on sensitive cartilage by teaching your muscles to absorb force. Prioritize the quadriceps, hamstrings, glutes, and calves to stabilize the joint from all sides. Add targeted mobility. Stretch the hamstrings, hip flexors, and quads to smooth joint tracking and cut down on unnecessary friction that can trigger sound.
Staying active matters more than chasing a surgical fix for crepitus. Surgery is rarely needed when noise is the main complaint. You get better returns by refining mechanics, building balanced strength, and managing body weight to reduce stress through the joint. If specific moves cause discomfort, modify them, shorten squat depth, reduce load, or substitute lower impact options like cycling or swimming while you rebuild capacity.
Form is your safety net. Progress gradually so you don't overload weak links. Control the descent on squats and lunges, keep knees tracking over midfoot, and avoid letting them cave inward. If a movement produces sharp pain, adjust or choose an alternative for now. Listening to your body is not avoidance. It's strategic. As strength and control improve, return to previously irritating moves and reassess tolerance.
Supplements come up often, and one stands out in the context of knee health: collagen. Collagen provides structural support for cartilage, tendons, ligaments, skin, and bone. For knee problems, a high-quality organic and/or grass-fed collagen supplement at about 50 grams a day is recommended in this context. Another accessible option is homemade bone broth, which naturally supplies collagen, gelatin, glucosamine, and chondroitin, along with amino acids like glycine and proline that support joint comfort.
Let's put this together into a practical plan. If your knees make noise without pain or swelling, keep training and emphasize form, strength balance, and mobility. If popping is paired with pain, stiffness, locking, or new instability, especially after an injury, seek evaluation to rule out structural problems. Support your long-term knee health with activity, body weight management, intelligent exercise modifications, stretching of tight tissues, and, if you choose, collagen or bone broth to reinforce connective tissue resilience.
Your challenge today is straightforward. Choose 3 moves, 1 strength, 1 mobility, and 1 low-impact cardio that you can perform comfortably for the next 2 weeks. For strength, try a body weight squat to a box height that feels stable. For mobility, pick a gentle quad or hip flexor stretch. For cardio, cycle or swim at an easy pace. Track pain and function after each session, adjust the depth or load to stay comfortable, and consider adding collagen or bone broth daily during the trial. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.